The following is a project of our nonprofit newsroom. Support Midcoast Morning and local journalism today at chly.ca/donate. Local news doesn't survive without local support.
Hello and welcome to Midcoast Morning. I'm Joe Pugh. International Overdose Awareness Day is August 31st. The concept originated in Australia in 2001, and it aims to bring communities together to honor lives lost, educate, and to explore evidence-based overdose prevention solutions. According to BC Emergency Health Services, paramedics responded to 1,525 drug poisoning events in Nanaimo last year. There are multiple events to mark International Overdose Awareness Day around the Mid-Island. In Nanaimo, the group Doctors for Safer Drug Policy is organizing a march and vigil this Friday starting at 11 a.m. at City Hall. Later on in the show, we'll hear about how people in Parksville are coming together to mark the day. But first, I spoke with a pair of representatives from Island Health.
I'm Shannon Witham. I'm the Regional Harm Reduction Coordinator for the Central Island for Island Health.
And I'm Dr. Mark Kasha. I'm one of the interim medical health officers for the Nanaimo Oceanside geography.
Well, thank you both very much for making some time to speak with me. How is Island Health marking International Overdose Awareness Day in Nanaimo this year?
And no, thanks so much for having us. We really appreciate the opportunity just to chat with community and especially about this very important topic. And so Island Health this year, there's various community events that are going on at our different locations to kind of commemorate and bring awareness to the ongoing drug toxicity crisis. And so I'm just looking at my list here. In the Nanaimo region, so on August 29th, from 11 a.m. to 2 p.m. at Nanaimo Regional General Hospital, there's going to be market-style tables with ribbons, resources, memory tree, and naloxone training hosted by Island Health. On August 30th, on Gabriola, there'll be a speaker and candlelight vigil. And then on the 31st in Parksville, from 4 p.m. to 8:30 p.m., there'll be the Parksville Community Picnic with the candlelight vigil, singer, and open mic, and it'll be hosted by the Oceanside Community Action Team and Mom Stop the Heart.
So the harm reduction team, which I'm a part, there's 4 coordinators for the whole of Vancouver Island. There's 2 for South Island, I'm Central, and there's 1 for North. And we have put together sort of an installation project. So there's 18 different sites participating throughout the island. And in Nanaimo, it will be at 528 Wentworth at the MHSU site downtown. And it will include a purple chair, a memory board where folks can put names of people they would wish to remember on the memory board, and access to some ribbons. And yeah, that will be at 18 different sites. So I do have a list, but throughout the island.
How has the situation with the toxic drug supply, the toxic drug poisoning crisis, how has that changed or evolved in, say, the last year?
And that's a great question. I think we're paying close attention to the data with our partners, such as BC Coroner Service, and as well with their local communities. I think we're still seeing the impacts of the pandemic and the disruption that it brought across to all of society, but specifically folks who use substances. However, we are seeing a bit of positive numbers right now. So a bit of optimism that we're paying close attention to. But it's such a complicated issue, ranging from toxic drug supply to housing to social determinants of health. So we're hopeful, but we know the work. There's still a lot of work to be done.
When you say we're still seeing the impacts of the pandemic, what exactly do you mean?
I think, and Shannon, feel free to jump in as well, but it did disrupt a lot of things, especially services that folks relied on to help with addressing mental health concerns and substance use. And I think we're still catching up from the ground that was lost.
Yeah, and because we had seen some improvement just pre-pandemic in a lot of the statistics, but it did disrupt a lot. But now as we see some stabilization, I like to think it's access to resources and education, naloxone training, things like that, that has really started to support some of that stabilization.
What is the current state? What do we know about the current state of the drug supply that's at the root of all of this?
I mean, we know it's incredibly toxic, but it's unregulated substances. We don't know what, no one knows what's in the substances that they might be using. We have access to drug checking at various sites, including in Nanaimo, at the Nanaimo OPS on Albert Street. But that's the only real way we know what might be in your substances that you might be using. So we encourage people to access those resources.
And I think we are seeing different combination of substances, such as opioids with benzodiazepines, and they're very different types of drugs. And unfortunately, naloxone only reverses the effects of opioids. And so that's why the kind of awareness, the education, encouraging folks to know what they're using, not using alone are so key, as well as kind of decreasing the stigma and having people tell their stories. So it's all very important. It's really a multifaceted approach to move the needle on this.
I've been hearing for a couple of years about benzodiazepines taking an ever-increasing role in the drug supply. Given what you just said about naloxone, do we know sort of what proportion of drug poisoning events are that case?
We know it's a very high percentage of samples that come in that do contain benzodiazepines, and it has informed how we respond to drug poisoning. So we go to the BC CDC, BC Center for Disease Control, for our most up-to-date source of truth in drug poisoning response. And, through them and through our experience since the beginning of this crisis, we have modified how we respond to drug poisoning. So naloxone is always your first bet. We always want to take opioids out of the equation, but in terms of the benzodiazepines, the other incredibly important piece of response is rescue breathing. So each naloxone kit has a one-way valve mask to allow people to give rescue breaths, because benzodiazepines, depress the respiratory system. So the more, along with the naloxone, we're giving rescue breaths throughout until paramedics arrive to support those life-saving efforts in every drug poisoning. It's part of the training. And if you go to the BC CDC website, Towards the Heart, it contains all kinds of resources, including videos on how to use naloxone. And naloxone is available for free to the population of BC. And you can access that at healthcare sites, pharmacies, groups that are doing outreach, things like that. Anyone doing work related to the toxic drug crisis on behalf of us and many community partners. So that has really, the rescue breathing is really, really important.
Yeah, and I think one of the great components of the Memorial Day is all these resources will be available and different training and folks to talk to. So we really encourage the community to go out and kind of learn about what's going on and what you can do as an individual to support your community and the folks impacted by this.
So there's been a public health emergency since April 2016 on the issue of drug toxicity, deaths from drug poisoning. It's coming up on the 10th year anniversary in not that many months. Why has it been so difficult to get a handle on this? As a health authority, what are the things that you maybe wish you could do, or what are the reasons why it's such an intractable problem?
And yeah, that's a great question. I think it's a wicked problem because it's so multifactorial from the toxic supply to the other social determinants of health that intersect it, such as housing and employment, stigma, racism. And I think addressing it requires a whole community approach. And so Island Health is one player in the overall scheme of things. Shannon and I are from population and public health, so we also hold a slightly smaller piece of that. And our focus of our work is really on the upstream prevention, such as from prenatal to early childhood to naloxone training to connecting people with care. But there's a lot of other important voices that I don't want to put words in our great colleagues' mouth, but we're really taking a whole team approach. And of course, along with that is really the relationships with the community and understanding what's going on the ground and how we can best support them. And I think that's where Shannon has been key in this work as she really holds a lot of those relations with the different groups. We're trying to problem solve this from different ways. And I think importantly is we need solutions that are relevant to the communities, and every community is different. And I think as long as we're all moving in the same direction, we'll continue to see progress and good outcomes.
I just have one small correction. It's just that I'm technically not in population public health.
Yes.
So the harm reduction team rests with a new portfolio created by Island Health called AMSU, which is Addiction Medicine Substance Use. But I do want to say that harm reduction is a public health initiative, and that, they're intrinsically related.
On that front, in the past year, one development we've seen locally is a group of doctors, addiction medicine specialists, run pop-up overdose prevention sites kind of near hospitals in the Mid and South Island region. How would you respond to calls for overdose prevention sites in hospitals around the island?
I think that's a great question, Joe, and I think probably that deserves its own time to really unpack it. I think what we want to focus on today is really the overdose awareness, and in honoring those folks who have lost their lives, who have been impacted and continue to be impacted upon it. And I think part of one of the great things about the events that are being held is it really allows people's stories to get told. And I think that's so important in navigating this crisis, is to remember that these are all people at the end of the day, and each of them have come from a different place. And we just need to meet them where they're at to best support them on their journey.
What does that mean, like meeting them where they're at? I'm sure someone would suggest that like part of meeting them where they're at might include a service like an overdose prevention site at a hospital. Yeah,
I think part of meeting people where they're at is having a broad spectrum of interventions, because people are at different roads or different points on their journey. And we want to support them and help them attain their goals. And so harm reduction plays a key role in that, decreasing the immediate risk to them, also decreasing risks of bloodborne diseases, the direct impacts of the drug toxicity, and then really understanding their goals and how we can best support them. So it's really an ongoing piece, as no individual is the same.
Yeah, and I think like the work that we do and that I do in supporting people in accessing harm reduction supplies is really important there, so we can fan out what people need, where they're at in their communities. Like as a harm reduction coordinator, there are over 100 sites, on the island that we support. And like also like the opportunity to spread education and awareness of this crisis and like reducing stigma for folks. So, making sure that people feel safe and comfortable in accessing services where they are at. We know addiction is really challenging, and there's so many socioeconomic pieces involved in it, and there's so many parts of the crisis that are so hard for people to see and to address. So making sure people feel safe accessing those services is where we're meeting people where they're at and building those services. as much as we can.
Is there anything else you think it's important to bring to the conversation about what Island Health is doing to mark International Overdose Awareness Day this year?
We are really highlighting, along with stories of folks that have passed, but trying to honor the contribution of workers and people working in this crisis. So frontline workers, folks that are impacted just working at the sites, not just in Island Health, but there's people, thousands of people doing this work, peers, workers, volunteers, all the things. So really honoring that impact because, we're 10 years in here and it is traumatic and difficult and we keep going, but making sure that we can take care of ourselves and just honoring that as well has been the theme this year. One big family is the theme this year.
Yeah, no, thanks so much. And I think the one last thing that we also wanted to mention is that Island Health, their mental health and substance use has started a service link, and it's a phone number you can call, and it's answered 7 days a week to help folks navigate the system and be connected with resources. So that number is 1-888-885-8824. And of course, if you're experiencing a mental health or substance use crisis, please call the crisis line, available 24/7, or 911, or go to your nearest emergency department.
Shannon Witham is a harm reduction coordinator for the Central Island with Island Health, and Dr. Mark Kacha is an interim medical health officer in Nanaimo and Oceanside. International Overdose Awareness Day is Sunday, August 31st. An event in Parksville will bring people together to mark the occasion. For more, I spoke with organizer Jamie Baird.
My name is Jamie Baird. I am the coordinator for the Oceanside Community Action Team. And if you don't know what community action teams are, I think there are 36 of them around the province. And our mandate is fairly specific. It's to keep people alive, to reduce the number of people who die from toxic drugs, unregulated drugs in BC, because so far there have been, I think, between 16 and 17,000 people have died. So we're trying to reduce that number. And how we do that is in so many ways, because it's caused by poverty, trauma, PTSD, mental health, addictions, substance use disorders. All of these things contribute to the deaths. So we can tackle it in a number of ways. And you asked me a question, which I can answer now. I went to it was called the CAT convening in Richmond I think it was the end of June. Yeah. And I sat at a table with people from all different CATs all over the province, and everybody that I spoke to, from downtown Vancouver to Maple Ridge, and then a bunch of them from the far north and the east, we have extremely different situations. The problem in Nanaimo is not the same as the problem here. No, not problems. And Port Alberni has got its own problems, and they differ from here. So we all have to tackle what's going on in our own way.
Could you tell me a little bit about what is going on in Oceanside and what your own way to kind of try and tackle it is?
There are just extremely limited services in Oceanside. There's really no place to go and do. Oh my God, I've forgotten what it's called. Anyway, when you just simply stop taking a drug, taking a substance, there's no place to go and do that. And then once you finish that and you're on to the next stage of recovery, there is really no place for you to go for that either.
Could you tell me how Oceanside, the event you're organizing, how you're going to be marking International Overdose Awareness Day this year?
Well, there are two things. The first one is we're having an event in the community park in Parksville, and it starts at 4, goes until 7 or 8, and it's in combination with this organization called Moms Stop the Harm. It's kind of a very beautiful venue, and we're surrounded by nature and sun and stuff. So it's really lovely. Other people will stand up and talk about their own personal struggles or their successes, their failures, their tragedies, all related to the same situation. So
when we talk about International Overdose Awareness Day, what do you think are the particular things in 2025 as we head towards the 10th anniversary of this being declared a public health emergency in BC? What do you think are the things people need to be aware of specifically?
Well, if it hasn't hit them yet, it will. The people who are doing the job that I'm doing are, not all of them, but many of them are really struggling, because it's just, you bang your head against the wall and you bang your head against the wall, and after a while you're tired of doing that, so you take a break. And at a meeting recently that I was at, one of the people who have been working really hard on this, she just started crying in the middle of the meeting because she can't get people to work with her. She can't get people to help. It's too much work and it's too tragic.
Is there anything else you think it's important to bring to the conversation, or anything you'd like to let people know about either International Overdose Awareness Day, this year's event, or the underlying issues?
The underlying issues are incredibly complicated, multifactorial and complicated. It's not something I can sum up in one or two sentences. International Overdose Awareness Day, welcome. We want people to come and be, to learn, to be made aware of the things that are going on. What else is, please, people, don't blame the victims here. The victims are the people you see on the street. They have mental health issues, or they have substance use issues, and that could be you, and it could be me, and it could be anybody, and it could be our children. And one more thing, we do a lot of, in Oceanside, we do a lot of harm reduction training, so people learn how to use naloxone kits. So we go to Arrington Market, or the Parksville Night Market on Tuesdays, Qualicum Beach Market, and Coombs Fair, and all of these places we go and we show people how to administer naloxone, and then we provide kits. That's all free. And people will often say, well, this doesn't apply to me. Well, no, it doesn't apply to you, but it could apply to anybody else, and they would then have an opportunity to save somebody's life. So if anybody hears me talking, then please go to the tables, introduce yourselves, and say, hi, you'd like to learn how to use it, and we'll be happy to show you.
Jamie Baird is coordinator of the Oceanside Community Action Team. We were speaking about an event this Sunday at 4 in the picnic shelter in Parksville's Community Park to mark International Overdose Awareness Day.
Midcoast Morning is part of our nonprofit newsroom project, supported by listeners like you. Keep this program on the air by funding it today with a monthly sustaining donation at chly.ca/donate. We've got tote bags and shirts if you need an incentive.
We're talking about International Overdose Awareness Day on today's program. VIU nursing professor Sarah Lovegrove says that recent years have seen a backlash against harm reduction measures. I spoke with her in the CHLY studio.
My name is Sarah Lovegrove. I am a registered nurse, professor at VIU in the nursing program, and the vice president of the Harm Reduction Nurses Association.
It is coming up on International Overdose Awareness Day in 2025. What is the first thing that pops into your head on this subject?
The first thing that pops into my head is I can't believe we're having another one of these days, and that we continue to see deaths and the talk about harm reduction in our community going this direction after 8, 9, 10 years of this crisis ongoing.
How have you seen harm reduction as a concept, like the way it gets talked about? How have you seen that evolve and change over time, and maybe especially in the last year or two?
So when I first began this work in 2018, and I would say pre-pandemic, there was actually quite a bit of compassion and understanding and interest and investment in wanting to create solutions that were evidence-based. However, since that time, and in the last several years specifically, we've been really seeing this outpouring of misinformation, moral panic, and a negative rhetoric around harm reduction and how it impacts people in our community in the toxic drug crisis. And it's really troublesome to see that. It's difficult to see how politicians have literally flipped their perspectives and their approach to harm reduction and solutions to the toxic drug crisis simply to cater to misinformation, stigma, and people's discomfort around what they're seeing out their doors today.
I want to get into that. Maybe to do so, it's important to first kind of set out, when we say harm reduction, what exactly are we talking about? What do you mean in the context of the toxic drug crisis?
So harm reduction within the context of the toxic drug crisis really seeks to reduce harm and negative impacts of a unregulated supply of drugs out in the illicit supply right now that is killing people, that is hurting people. It's causing irreversible brain injuries. It's caused the death of over 500 community members since 2016. And harm reduction as a way of being, as a approach to public health, as a healthcare tool, seeks to reduce and minimize those harms on our community members.
And so what are some of the ways that plays out kind of concretely?
Concretely, as we've seen in response to the toxic drug crisis, I mean, we see it more broadly within the context of our everyday lives: sunscreen, seatbelts, wearing helmets, masking, wearing gloves, using hand sanitizer, washing our hands. But within the context of the toxic drug crisis, we're seeing overdose prevention sites that reduce the number of deaths when people use illicit substances. We're talking about safe supply or prescribed alternatives that give people a safe prescribed pharmaceutical alternative to the illicit supply that they're able to utilize, knowing the potency and amount that they're taking at every time. We see clean needles and pipes and harm reduction supplies being distributed to reduce the amount of infectious diseases and other communicable diseases amongst folks using drugs. We have naloxone kits that are distributed widely across the province now that literally keep people alive. They reverse overdoses and save people's lives. And yeah, we see all of that happening in the community, but what's really being talked about is the stigmatizing approach and perspectives on those public health tools that we're using to keep people alive and safe within the context of this toxic drug crisis.
And you alluded to the fact that there's been something of a backlash against some harm reduction measures. For example, this summer we saw multiple communities in British Columbia kind of motions brought forward calling for the closure of overdose prevention sites. What do you make of that situation?
Yeah, we saw that here in Nanaimo when Councillor Thorpe put forward the motion to, make changes or close down our local OPS run by Canadian Mental Health Association and Island Health. And his reasoning behind that and what he conveyed to the public in that motion was rooted in misinformation. It was rooted in stigma and inciting a moral panic within our community around what this is. So, these counselors are coming forward with these motions as leaders, as elected officials within our communities, and without any accountability or, support in terms of what they're saying from evidence. So counselors are alluding to the fact that free drugs are being given out at the overdose prevention sites when that's not a reality. At any overdose prevention sites, these spaces are meant for people to bring in the substances of their choice that they procure on their own and consume them in a safe, supervised space where someone can respond if they overdose. So we're seeing that happening across the country, across BC. We're seeing, was it last year or 2 years ago, they removed the harm reduction vending machine from NRGH as a response to someone's political TikTok video communicating misinformation about what was actually in those harm reduction vending machines. And the conversation around what was in those vending machines was so deeply misunderstood that even people within the hospital, working within the hospital, thought that machine was giving out free drugs. So that's just the depth to which people are so entrenched in misinformation and moral panic and stigma around substance use that they can't actually understand the reality of harm reduction.
What do you think is the way? So obviously harm reduction, if you're going to make an allusion to say like seatbelts, it's not like having seatbelts will stop car accidents from ever happening. If we're talking about ending the toxic drug crisis, I imagine it's the same thing. It's not like harm reduction is going to stop that from being an issue. Do you think people have the perception, though, that there's still a toxic drug crisis, and for a while some funding was given to harm reduction measures and the drug crisis didn't stop and therefore it's not working? Yeah,
I think people really like the idea of problems and solutions, but the toxic drug crisis is a far more complex issue than simply, instituting a single measure that will reverse and make it all go away. So harm reduction is instituted as a means of keeping people alive and keeping people safe within the context of this emergency. It's not proposed as a solution to the toxic drug crisis. We have to go far deeper than that. We have to look at the illicit supply. We have to look at the regulation of substances. And we have to offer people a safe alternative to what's happening on the street in order to actually solve problems. But what people see is their tax money going into harm reduction measures. They're seeing increased homelessness. They're seeing increased, quote unquote, social disorder on the streets. And they're lashing back at the government for investing in its harm reduction measures over the years. And politicians work for taxpayers. They work for voters. And so in order to get reelected, they're flipping the script and they're trying to go back on all the things they've said around harm reduction and changing their priorities around that in order to satisfy these taxpaying voters.
So what are the changes that you would like to see instead?
What I would like to see is further investment in harm reduction across the board. So, in our local community, I would like to see more overdose prevention sites broadly distributed across the community instead of just the one downtown. More alternatives, so peer-based overdose prevention sites like what Nandu's been offering. We need more access and more accessibility around what people call safe supply or prescribed alternatives. So people having access to what a pharmaceutical alternative to what's on the street right now to meet their needs. And then we also need this full broad spectrum of recovery and detox and all the options for people to go in. I think the government has really, dichotomized and put on two separate pillars, harm reduction and recovery, but what they are is a continuum. And people often access harm reduction and access free supplies and free prescribed alternatives as a means to their journey into recovery. So it really has to start somewhere in order to get to the final destination, which is perhaps abstinence or being substance free.
In a lot of the discussion around some of the services where there's been a bit of a backlash to services, specifically in Nanaimo, it feels like people's concerns aren't necessarily with the service themselves, but are concerns maybe with incidents of what I'll call social disorder that happen kind of around or after hours or outside of services. And I'm wondering if you have any input on that situation, how it could be avoided or addressed.
Mm-hmm. Well, essentially, like when people are seeing things on the street that they don't like as a result of, substance use or people living rough, the solution is always housing. People need somewhere to go. I often talk about with people, like what would happen after services are closed down and you didn't have somewhere else to go. What would your evening look like? What would your morning look like? Where would you go to the bathroom in the morning? So people are really upset about all these people out in public doing the things that they normally need to do to survive, but they just have nowhere to go. So my proposed solution is and always has been house people, give people places to go. People need, if people need to use substances, their preference is often socially within the context of someone's home, under shelter. It's never someone's first choice to go out into the street and use in public where in the context of, other people seeing you or things like that. It's more about we need to have spaces where people can go and exist and live their lives. So housing people will solve the social disorder issues that we're seeing.
International Overdose Awareness Day. What do you think are the things in particular that people should be aware of? Granted that we're close to 10 years into this being a declared public health emergency, and I think everyone understands that it's a serious issue that doesn't seem like it's got a solution on the horizon.
Yeah. The topic of awareness is complex, I think, because I more broadly, I think awareness, I think we've got it. I think politicians, I think everyone who has a stake in this issue is aware. I think what we're lacking is the political will and the courage to create the change we need to do. However, more broadly at the community level, I think stigma is still a major issue around the understanding of the toxic drug crisis, around substance use, around addiction. And so creating an awareness around what is actually happening with this, toxic drug crisis, or what once was called the overdose crisis, is that, this is not a fault of individual choice. This is not people who have, taken a wrong turn in life and made poor decisions. And this is a systematic issue. This is an issue of oppression. This is an issue of multiply marginalized individuals suffering as a result of poor policies that date back to the Indian Act. Racist policies that have been enacted and ingrained in our system that create oppressive dynamics for certain individuals within our communities, and, trauma, intergenerational trauma, results of residential schools. These are all pieces that we really have to be aware of and how it's feeding into this toxic drug crisis that we're seeing right now.
Is there anything else you think it's important to bring to the conversation about International Overdose Awareness Day or the related issues?
I think really what I would say in terms of awareness, in terms of bringing this issue into the community, into the public eye, is encouraging people to use their voice and share their stories. And, doing this work since 2018, I've seen a lot of the same faces, and I appreciate and love them deeply for sharing their stories. But I think, so many people in our community have been impacted, and so many people are suffering in silence. So families, friends are grieving alone because they don't feel that this community is a safe space to hold the compassion and love and grief that they have for their lost loved ones, simply because they died as a result of drugs. We see notices in the paper, online, through VIU, like notifications of people's death, and not talking about the cause of death, because the issue of toxic drugs and the issue of substance use is so stigmatized that even after death, people don't want to talk about it. And so I think the more people share their stories, the more people say the names of their loved ones who have been lost, the more we can embrace each other with compassion and understanding and collective grief, recognizing that grief is simply the other side of what we experience of love, is that we can build more of a community around how to hold this, and to not allow that, unmet, unseen grief turn into anger and turn into, combating your unhoused neighbors and judging them and calling the police, when we can actually, open our hearts and look at them as human beings and say, you are just a human being in need of connection. So I think we need to speak up. I think we need to use our voice. I think people are tired of hearing from me and other people who have been, preaching on our soapboxes for however many years now. I would love to see more people get involved. I would love to see more people share what they've gone through and what their families have gone through and the meaning behind that.
Sarah Lovegrove, thank you so much for coming down to the studio.
Thanks for having me, Joe.
Sarah Lovegrove is Vice President of the Harm Reduction Nurses Association and a nursing professor at VIU. That's our show for the day. Thank you for joining me. I'm Joe Pugh, host and producer of Midcoast Morning. Jesse Woodward is our executive producer, and Arby Fruit is our technical advisor. Our theme song is First One by local Nanaimo band Waste Management. If you have a story you'd like us to cover, email us at news@chly.ca. That's all for now. I'll talk to you on another Midcoast Morning.
This program gives thanks to the Nanaimo First Nation as we broadcast and podcast from their traditional territory. Thanks for listening.